Here's what's coming up on your horizon. Well, Oklahoma consistently ranks poorly when it comes to our physical health. Even so, it may surprise you that when it comes to mental health, the state fares even worse. Today, we're going to look at both the causes and the solutions to an issue that is costing all of us in our pocketbook. Stay with us for Oklahoma Horizon.
Oklahoma Horizon is made possible by the Oklahoma Department of Career and Technology Education.
Oklahoma's investment in Career Tech provides more than nationally recognized technology education and training. It produces solid financial returns for the state's economic future. Oklahoma Career Tech, elevating our economy.
And the Oklahoma Department of Agriculture, Food, and Forestry, helping good people grow good things. And now, from the Career Tech Studios in Stillwater, here's your host, Rob McClendon.
Hello everyone, thanks for joining us here on Horizon. Well, today our focus is on a subject that makes many uncomfortable, yet impacts almost every family. From bouts of depression to full-blown schizophrenia, mental illness is just that, an illness that affects a growing number of Oklahomans. Joining me now is our Andy Barth.
Well, Rob, it's the biggest health issue in the state. With 1 in 4 Oklahomans suffering from a mental illness, many find it more and more difficult to find treatment, an issue that has many calling for change. It's an uncomfortable topic for families, for schools, and for businesses. But the impact of mental health affects all Oklahomans.
We need to really begin to change our attitudes. We still have a very archaic attitude about the realities that mental illness is a part of life.
Mike Brose is the executive director of the Mental Health Association in Tulsa and says work must be done to reach mentally ill Oklahomans more efficiently.
We've got to figure out how to move upstream and how to do more preventative work, more education. We need to start at younger age.
And for mother Shelly Cademy Munoz, mental health in young people is part of her daily routine.
I adopted 3 older siblings from foster care. Both of my older kids have been institutionalized multiple times, and it's been really tough to find resources for them.
Munoz's children have a condition called reactive attachment disorder, a condition that hinders a child's ability to establish healthy relationships due to abuse. And Munoz says finding help was difficult.
Shadow Mountain is the only facility in the entire state of Oklahoma who has beds available for kids with reactive attachment disorder.
Now, the lack of mental health treatment in the state is not uncommon. Nearly half of Oklahoma's private therapists don't accept health insurance. And according to the Federal Substance Abuse and Mental Health Services Administration, Oklahoma has the 2nd highest rate of adults with mental illness. And on the other side, we're the 7th lowest state that offers mental health funding, leaving many families with limited options.
The biggest problem is our system does not handle mental health like any other health issue, and it is just like every other health issue.
Kathy Dossie has been a pharmacist for more than 3 decades and has had numerous break-ins where prescriptions were taken. Yet her experience goes beyond stolen drugs. Dossie's daughter was in a car accident in 2011. The driver, her drunk husband, changing both Dossie's and her daughter's life forever.
She was instantly paralyzed from a C4, C5 spinal cord injury. And because it would have been his 3rd DUI, he left her there and had somebody come and get him. Obviously, she was paralyzed, couldn't move. They called 911 after the fact for them to come and get her after they left. Was supposed to be a quadriplegic, and she was for about 6 months. And we just kept fighting, and we beat it. She passed her driving test in October of that same year in a car with no handicap controls. She works with a cane.
Yet that was only the beginning of her struggles.
The medications that she had been given were not solving the problem. The problem was that there is pain. There is internal pain, not physical pain, mental pain, emotional pain, from someone leaving you to die in a car that you're married to with a 2-month-old child.
Dossie's daughter turned to street drugs to help mask the pain, a common occurrence with those suffering from mental illness. Yet, unlike Dossie's daughter, many Oklahomans suffering from mental disorders are sent to prison, something Brose says needs to change.
We need the legal community, the mental health community, the substance abuse community, and the law enforcement community. We need to come together and really put our best minds around developing protocols so it doesn't keep moving downstream and suddenly what was a medical mental health need suddenly becomes a law enforcement incarceration issue.
And Brose says the best way to start the discussion is to stop ignoring the issue altogether.
People are still ashamed. They're still embarrassed. They don't want to talk about it. We don't talk about suicide or threat of suicide. We don't want to talk about schizophrenia, bipolar disorder, shame, embarrassment in families, and the little secret nobody wants to admit or talk about, it's in every family.
Which fuels Dossie's frustration when doctors don't treat mental illness like any other health condition.
You wouldn't think for a minute of a diabetic going into a hospital, showing up in an ER with blood sugars of 600-700. You wouldn't think for a minute of treating them for a few days and then turn them loose with nothing else. No blood sugar control meds, no blood sugar strips, no machine. You wouldn't even consider that. But we do it every day in mental health. Every day.
Families struggling, supporters at a loss for direction, and patients left in the dark. Now, Oklahoma's population is 3.8 million. Of that, up to 950,000 Oklahomans suffer from mental illness. That's 25% of our population. And Rob, it's a number that could easily go up if the system isn't changed.
So of that 25% that need mental health services, how many actually get it?
Well, Rob, it's another troubling number that 70% actually don't get mental health treatment. It takes a lot of time, persistence, and money, and it's really, really expensive. For example, Kathy Dossie, who we heard from in the story, her daughter was checked into a private inpatient rehab facility. That price tag, $18,000 a month.
Wow, certainly a startling number. Thanks so much, Andy. Now, a little later in our show, we will look at the cost mental illness has on our legal system. But when we return, a conversation with the Commissioner of Mental Health and Substance Abuse Services for the state of Oklahoma.
You're watching Oklahoma Horizon, featuring some of the good things that are happening in the great state of Oklahoma.
Well, Oklahoma's Commissioner of Mental Health and Substance Abuse Services, Terry White, has a job that is as much about education as it is treatment. I visited with her in a Spartan conference room just outside her office. So, Terry, what type of impact is mental illness having on the state of Oklahoma?
Actually, mental illness is the third leading cause of chronic disease in our state. Only pulmonary conditions and hypertension are more common. There are more people struggling with mental illness than there are struggling with heart disease, diabetes, cancer, or stroke in Oklahoma.
And that has to have both an economic and social impact.
Absolutely. Mental illness and addiction are diseases like any other disease. Just like diabetes is a disease of the pancreas, where your pancreas doesn't secrete the right amount of insulin, mental illness and addiction are diseases of the brain, where the chemicals in the brain aren't being secreted correctly, or in the case of addiction, where because of additional chemicals in the body are causing chemical reactions that otherwise wouldn't have been there. Well, just like any disease, if you have diabetes, heart disease, or the more common disease of mental illness, when it goes untreated, then we see dire consequences. We see obviously the consequences to people's health, but we see the beginning of breakup of families. You see people losing their employment when they're struggling with mental illness and addiction when they don't get access to treatment. Ultimately, you can see people ending up in the criminal justice system because they can't get help anywhere else. And then finally, some of the worst outcomes is when we see people who lose their lives, either due to drug overdose, suicide, or other things.
I've seen studies that says Oklahoma has one of the highest rates of mental illness. Why is that?
So we actually have the second highest rate of mental illness in the United States. And a lot of times when I say that, people say, well, how can that be? Well, if you look at all of our health statistics, we're often ranked at the bottom. We're not good in health. We are 48th, 49th, and 50th, and that's bad. So the year we were ranked 43rd, we were really excited. Well, we have high rates of all diseases. So when you have high rates of all disease, of course you're going to also have high rates of brain disease. What would be really weird is if we had these really unhealthy bodies from the neck down and had these bizarrely healthy brains trapped in these really unhealthy bodies. But as long as we're not healthy as a whole, we're going to have high rates of mental illness and addiction because they're just like any other disease. It's just it affects a different organ. It's the brain as opposed to the heart or the lungs or the pancreas.
So we know we have the problem.
Absolutely.
What do we do about it?
Well, one of the biggest challenges we have in Oklahoma is that we're only able to serve about 1/3 of Oklahomans who need help. So on any given day, about 2/3 of Oklahomans, and I'm talking about adults and our youth, because mental illness is a disease of the young. Half of all mental illness emerges by age 14, 3/4 of all mental illness emerges by age 24. And addiction also begins when people are young. It's not something we have to think about, gosh, as I get older, as I get into my 70s or 80s, am I going to develop mental illness or addiction? It doesn't work like that. And the fact is, for our youth and our adults, about 2/3 of Oklahomans who need help can't get access to services. And it is a resource issue.
Mm-hmm. And so when you say resources, are we just talking about money?
And so there's a couple things that we're talking about. One of the biggest challenges, and I know it's not everyone's favorite topic, but one of the biggest challenges is resources, it's funding. Because for decades, no fault of current administration, in fact, Governor Fallin has been very supportive of issues related to mental illness and addiction and funding treatment and prevention. But what we know is that for decades, these issues were misunderstood and neglected, so we are now trying to recover from decades of neglect. The other thing that we know that really gets in the way of treatment is the stigma that surrounds mental illness and addiction. And it gets in the way in a couple of ways. One gets in the way of it being a funding priority. When people are running for office, they run on education, they run on roads and transportation, they run on taxes. Very rarely do you have people who run saying, I'm going to help Oklahoma's brains in terms of mental illness and addiction. Although that would actually make a huge difference in our state in everything, and we'll talk about that in a second. But what we also know is the stigma keeps people from asking for help. That somehow people will say, if I was wearing a pink ribbon today, you might know I was standing up for breast cancer, and we could talk about that. People whose children need asthma, make sure that the school nurse knows, here's their asthma medication. We get help for heart disease. We have beautiful new cancer centers around our state. But the fact is, with mental illness and addiction, somehow, completely inaccurately, there's sort of a stigma that relates to those diseases. People are either afraid to ask for help or they think maybe treatment doesn't work, but that's absolutely not true. These diseases can be successfully treated just like any other disease, but not if people never get medical care.
So is the first step for the state just to recognize that it is a problem and there's something that we all should be doing?
Absolutely. I think the first step, like you're saying, is there's a role for all of us. One is that we have to start talking about these issues among our families, the same way that if we had heart disease that ran in our families, we would talk about it. And we need to talk about mental illness and addiction. Not only do we need to talk about it there, but we need to talk about it in our schools. We need to help identify people at a much younger age instead of waiting until the consequences. And what I mean by that is, we don't need to wait until someone's getting in trouble in school, youth who appear to have acting out behavior, but what it really is an untreated mental illness or addiction issue. We don't need to wait till our youth drop out of high school or drop out of college because they're struggling. We don't need to wait until we've got someone who's become employed but is now struggling with mental illness or addiction and is beginning not to show up at work and they end up losing their job. We need to not wait until we end up at ultimately where people are ending up in the back of a police car, the inside of a jail cell, or the inside of a prison cell because they have an untreated disease as opposed to entering a medical facility.
Still to come on Oklahoma Horizon, breaking the stigma surrounding mental health. But first, the legal costs of mental illness.
Well, too often the mentally ill wind up behind bars, incarcerated for any number of crimes that are the outcroppings of their mental state. And law enforcement officials are quick to tell you they're frequently unprepared to deal with the severity of mental illness they often face. In the first of a team report on the impact mental health has on our legal system, OETA's Liz Exon visits the Tulsa County Jail.
It is a solitary existence. There is no socializing with other inmates. Food is served through a slot in the door. Cells are windowless spaces with only a cot, sink, and a toilet, nothing that could be used to harm themselves. The letters MHE are listed by the names of inmates on a chart. It means they're waiting for a mental health evaluation. The chart also shows warnings for each shift about inmate behaviors. Major Shannon Clark is the Tulsa County Jail Administrator.
And out of the 1,800 that we house on an average, 600 are on some type of psychotropic narcotic. And that is a minimum number.
With 30,000 people jailed here each year, that could mean about 10,000 people locked up here annually suffer from mental illness. Some of those inmates are housed in a restrictive cell block. Clark says it's not what employees signed up for.
You have to come in here and deal with the people that spend the majority of their day spreading their feces around their cell because that is their form of entertainment. And then a detention officer has to uniform up in all kinds of biohazard gear to go in there and clean it up. That's what they have to do every day in this facility. People urinate on themselves, people are self-mutilators and they're cutting themselves, so you got blood in certain areas. They have to deal with this kind of stuff.
Clark says such behavior could be prevented with certain psychotropic drugs which need careful monitoring and can't be given in the jail.
Now, we have a great medical facility on staff. We have great doctors that really do care for the patients that they treat. The patients that they treat are locked in on criminal charges, so there's a lot of things they can't do for somebody they could do on the outside, or somebody they could do that would be in a hospital setting opposed to a jail setting. There's certain medications we just won't tolerate here at this facility. So there's some things that they just can't give them.
Those who are a danger to themselves or others end up in the jail's medical unit. According to the Tulsa County Sheriff's Department, this inmate, like several dozen others, doesn't even know he's in jail. His cell is next to others housing inmates suffering from physical health issues. In another cell for inmates considered suicidal, inmates ripped up the linoleum floor hoping to create a sharp object with which to kill themselves. At any given time, there can be 20 to 30 inmates on suicide watch. Michael Brose is the executive director of the Mental Health Association of Oklahoma.
And we're putting them in jail. Really? So this is a big deal, and it's been a big deal. It is a big deal. So every day in towns and cities across Oklahoma, every day, there are people who are in an untreated state of mental illness, symptomatic, distressed, troubled at no fault of their own, and they're being picked up by the police, charges filed, and they're being taken to jail. That is going on every day.
It is a process that is completely destroyed and damaged and flawed. I don't know how else to characterize it. There is no process in place.
Major Clark says because the court system is so backlogged, the Tulsa County Jail has become the largest psychiatric facility in the state.
There's only one maximum security confinement for mental health people in Oklahoma, and it's full. We've got a waiting list for almost 30 people just from Tulsa County waiting to go. There's 76 other counties in Oklahoma.
And I'm Austin Moore in Payne County, where departments like Stillwater Police are also feeling the cost of mental illness.
Norm McNichol is the past president of the Oklahoma Association of Chiefs of Police and Stillwater's Director of Public Safety.
Resolving issues with persons who are seriously mentally ill, it is enormous. It impacts the state of Oklahoma to the extent of $3 to $5 million a year that is spent simply transporting people around the state for treatment. There's one example in the city of Stillwater last year, 187 transports. It's not the number of calls that we answered about someone that was having mental health issues. That's the number of people that were actually determined to be in need of treatment and that were transported to a facility somewhere in the state of Oklahoma.
It isn't simply the nearest facility either. With options as far-flung as Fort Supply, Ada, McAllister, and Veneta, the patient will go to the first available bed.
They're handcuffed. Frequently there's a belly chain that connects the handcuffs to their waist, leg irons if they're resistive, a helmet if they're banging their head against the windows of the screen partition of the unit, spit mask, and they travel that way anywhere from 2 to 6 hours, depending on where in the state there's an open bed. And that just can't be good for them. And it can't be good for the future of them seeking help from law enforcement once they've been given that kind of treatment. And it's done that way to prevent them from injuring themselves, from injuring the officers, so they can't jump out of the car,
McNichols says this is also taxing on the resources and budgets of local law enforcement.
A vast majority of the 400 law enforcement agencies in the state of Oklahoma are very, very small. So they don't have the resources, monetarily or from staffing perspective, to easily handle this situation. So oftentimes their town goes uncovered. There's no law enforcement present in the town while they perform these duties.
Now, according to McNichol, each case can easily take 8 to 16 hours of an officer's time. And when a psychiatric hospital bed is not available, much more.
All right, thank you so much, Austin.
You're welcome, Rob.
Well, much of the Department of Mental Health's budget requests in the next legislature is part of the Smart on Crime initiative that seeks more funding for mental health and drug courts, along with more local crisis beds that will keep the mentally ill out of the criminal court system. Mental Health Commissioner Terry White.
Yeah, one of the things that happens is we have these amazing partners in law enforcement whose job it is when someone's at risk of hurting themselves or someone else is to get them to help. But when we don't provide enough resources locally, when there's not enough crisis beds or hospital beds for someone experiencing a crisis, then law enforcement ends up driving hundreds of miles sometimes trying to find the next available bed or the closest available bed. Well, that's a horrible use of our law enforcement resources. If we got more resources in the community, law enforcement are often the first interaction with someone who's struggling with mental illness or addiction. And if they had a medical facility to get them help right there locally, imagine how much earlier in the disease process we could catch someone. And just like any other disease, the earlier you treat a mental illness and addiction, the better the prognosis. The longer we wait if we have heart disease. If I have 20% heart damage and I wait to get help until I have 50% heart damage, the doctors will all tell you, you're not as likely to have full recovery. Well, if I'm struggling with a disease of the brain where the chemicals aren't being secreted correctly, the longer I wait to see a medical professional to get that taken care of, the less likely I am to have full recovery. But people can and do recover, and they have better prognosis the earlier we get them into treatment.
Want to share something you've seen here today? Well, all of our episodes are streaming on our YouTube channel at Oklahoma Horizon TV. Or you can subscribe to our weekly free podcasts on iTunes. And while the issues surrounding mental illness in Oklahoma are certainly complex and often expensive, the alternative of doing nothing is even more costly. Once again, Commissioner White. So faster intervention, does it need to be more intensive intervention as well?
So it depends on the person. Probably the disease it's most like to think about is diabetes. Most people manage their diabetes in the community. They need to see their physician. They need to do the parts that their responsibility, their diet, their exercise. But for some people with diabetes, sometimes their disease becomes acute enough. They get sick enough that they do need a hospitalization. But it's short term, and they go back into the community, re-engage with their outpatient services, continue to raise their families, continue to be involved in the community, continue to hold down a job, all of those things. That's exactly what happens when people have treatment for mental illness and addiction. If we intervene early, most people can maintain their mental illness and addiction in an outpatient setting. Most people hold down jobs, raise families. In fact, we have policymakers, we have heads of companies, we have heads of our communities of faith who are in recovery from mental illness or addiction. But the stories we often hear about are the tragic stories, and people don't realize that if we get people into treatment early, most people don't ever need a lengthy hospital stay. They can maintain their disease in the community as long as they have access to outpatient services. But when it's not available, sometimes people do end up in acute crisis, and they do need that hospital bed that law enforcement needs to be able to get them to very quickly. But we need it there in the community for a short stay and let them go right back to work and right back to their families and back to their outpatient services.
So would you hope that the people that are these success stories, they would tell those stories?
I think that's incredibly important. One of the things, unfortunately, we've seen recently is the tragic death of Robin Williams, which I think affected people in a different way because it made people think about depression slightly differently than they had before. But then we have other stories of people who are amazing leaders or actors or actresses or whatever it is that we might look up to who do lead lives of full recovery. And sometimes the stigma prevents people from telling that story. We talk much more about other diseases that Robin Williams struggled with than we do about his actual depression and addiction. But the fact is that if we could break through that stigma, I think, one, we'd see more people seeking help. we'd see more people sharing their stories, which not only aids in their recovery, but sometimes helps pave the way for someone else to step forward and say that they need help. The same way we used to whisper about cancer, we don't do that anymore. We need to get past the day where we whisper about mental illness or addiction or have these images in our mind that just aren't reality. Mental illness and addiction looks like you, it looks like me, it looks like our friends and our family. It's 1 in 4 Oklahomans. It looks like every single one of us. And the consequences are dire when we don't get treatment, but recovery is amazing when people get access to care.
Commissioner White, thank you so much.
Thank you so much. Appreciate it.
Next time on Oklahoma Horizon, we'll look at local food in our neighborhood schools.
It's pretty good.
And guess who we ran into in southeastern Oklahoma?
We found Bigfoot.
That and more on Oklahoma Show Over the Heartland, Oklahoma Horizon. Well, thanks for including us as part of your day. I'm Rob McClendon. See you back here next week.
Horizon is made possible by the Oklahoma Department of Career and Technology Education and the Oklahoma Department of Agriculture, Food, and Forestry, helping good people grow good things. Thank you for watching Oklahoma Horizon.